Hello, welcome back to See the Stories. This is a 3-hour news show special segment. Now, reports have been circulating that a number of people in Indonesia have been exposed to monkeypox. In the meantime, we just dealt with COVID-19 fright.
We thought we just got out of a very, very terrible situation.
Yeah.
But now we've found in Indonesia examples or even cases that is a result of a monkeypox virus or Mpox. And the problem is that we have to know now how to deal with it and also how to prevent us from being infected. So joining us in the studio today to talk more on the matter is dermatovenerologist Dr. Alfonsus Laksiditalia Nugroho, or Dr. Randy. Thank you so much, Doc, for coming to the studio.
Thank you so much, Nadia and Hans, for having me again.
You're welcome. So we have about 34 cases in Indonesia, 27 in Jakarta, if I'm not mistaken.
Sorry, 30 cases.
30 cases.
24 cases in Jakarta and 5 cases in West Java.
I see.
And 1 cases in Banten.
Right. So first of all, maybe we want our public to know as well, our viewers to know, what is actually monkeypox? Okay. And also, how can it be transmitted to humans? Is it from human to human? Is it possible from animal to human, for example, or other things as well? Maybe you can start from there.
Okay, so talking about monkeypox is quite a long story because it coming from outside of our continent, from Africa. So basically, monkeypox is actually an endemic illness in Africa, but recently is found out by the by the doctors that it's also occurred in places where usually there is no monkeypox. That is why it becoming outbreaks or global outbreaks in 2022. Recently, we're fighting with the COVID. We don't know that there's an outbreak of monkeypox virus. It started in United States actually in 2022. But however, the monkeypox is divided into 2 strains. The first strain is the Central Basin, or the first strain, we call it. It's only happened in the central of Africa, which is the Democratic Republic of Congo, Sudan, and also all the part of the Central Africa with higher mortality and severe conditions of the patients. While the second strain is outside part of the West African country, like Sierra Leone, like the Ivory Coast, where we call it as the strain 2B. That strain is most related to the outbreaks right now.
In Indonesia.
In global, in the world. That is why World Health Organizations makes a warning that this might be becoming an outbreak. However, they have low risk to becoming an outbreak like the COVID as you worried about. But however, we have to be, ready and cautious about that because the cases is not just only in Africa now, it's all over the world. The strain that coming to outside of Africa is the strain of 2B. Which is related with the
Western Africa.
The West South of Africa.
The question was, how can it be infecting humans? As you mentioned, it's actually started in the United States. So is it because people traveled and maybe in contact? And how bad is it? I mean, as COVID-19, we're very, very scared because just being in this distance, we can be infected. But how about monkeypox?
Well, monkeypox in United States was found that persons coming from the Africa, coming to United States, and then having the monkeypox confirmed by the PCR examinations of the lesions of the skin rashes and vesicles. But today, monkeypox is quite different with that monkeypox occurs in the first time.
Wait, so it has been mutating?
Yeah, evidence said that it was different because in that times, usually the patients have a history of going to African continent. While the monkeypox that we have now, they don't have any history of going to Africa. And the second one, the difference of the monkeypox in 2022 and right now is it's not being reported needed a reservoir of animals. So here we go. Here's the thing. It's quite complicated because the monkeypox is actually a zoonotic disease.
Yeah.
So it needs to go to animal. That is why it's called as a monkeypox.
Yeah, because it started.
Yeah. Because it happened
Infected among monkeys.
No, the first time is founding in Denmark around 1958. And the lab monkeys, they found out that there is a monkeypox, and then, but during the times, it's been known that the reservoir is not only monkey, but also rodent, mostly rodent, like Gambian rats. And in America is reported happened because of the bite of the prairie dog. Some of United States citizens have a prairie dogs. Prairie dogs is actually a rodent too. It's not a dog. It's like a rat, like have characteristic like a dog. So they call it prairie dogs, and they get bit and then happen having the monkeypox. But the monkeypox that we have nowadays, especially the one that we have in Indonesia, 24 cases in Jakarta, is actually transmitted from human to human.
Right.
Okay.
So it doesn't, the difference is it doesn't need a reservoir of animals.
So it's through contacts,
Yeah.
droplets, or how?
So there are three main characteristics of the infections. First is a close contacts. The contact needs to be very close, especially it's being said that it mostly coming from saliva, a droplets that size bigger than the COVID, because COVID is an airborne, right?
Yeah.
This one coming from the droplet and have a close contact, meaning less than 6 feet interactions, more than 3 hours, and especially in sexual intercourse, because when people do the sexual intercourse, they have a very close contact, right?
Yeah.
So that is why first close contact, and second is from the material that contains the monkeypox virus, probably the bed sheets, or if you borrow someone else's clothes.
Yeah.
It means that they can also have the monkeypox virus infection from there.
Wow.
And the third one, the World Health Organization is not put characteristic as a sexual transmitted disease. However, since the number is really high in the men having sex with men, it was being said that among those populations have more high risk of monkeypox, especially men having sex with men with multiple partners.
Yes.
Multiple sex
Yeah, multiple sex partners.
Okay, so this is very wild in media at the moment, in social media, let's say, because people have been, assuming on the symptoms of monkeypox, and they've been comparing it with chickenpox, or some people even said about
bacteria,
smallpox and skin rashes. But what are actually the symptoms of monkeypox?
Okay, first, if you have the characteristic of the monkeypox, first of all, you need to have the fever, because the incubations will be like 6 to 13 days prior to contact.
Okay.
And usually when you have a close contact with people or patients with monkeypox, like for the example, my patients, he actually have a close contact with patients with monkeypox, and among those incubations period, he suffer from fever, vesicles. Vesicles is like a crops or rashes that we have blisters on your skin.
Yeah.
Lesion.
And the lesion that's really painful to touch.
So it's not itchy, it's painful.
The dominant is more painful. Rather, unlike the chickenpox, it is more itchy, right, in the first period of times. But this one is more painful. Sometimes it even disturbing the social activity or daily activity.
So according to the patient, from 1 to 10, how painful is it?
Like 7 to 10.
Wow, that's
So patients really suffers from the pain. And sometimes we have to give the painkiller from paracetamol, tramadol, which is it's only being able to get to the patients by the doctors prescribed, and also the morphine. We give morphine also if they have a very severe painful. It's already in the guideline of the health minister
that
of
advanced.
Indonesia.
I mean, for a person to get morphine shots or morphine treatment because of
It
that.
probably depends on how bad it is. On
Yes.
us, right? Okay, we're going to continue talking with you, doctor. But before that, let's have this updates as well regarding monkeypox issue. So the number of monkeypox cases in Indonesia has increased to 30 according
30.
to our doctor, with 5 of them occurring in South Tangerang, Banten.
Well, however, Indonesian Health Minister Budi Gunadi Sadikin assured that their conditions continue to improve.
Speaking after attending a hepatitis B immunization event at the Tangerang General Hospital, Health Minister Budi Gunadi Sadikin said that the number of monkeypox cases in Indonesia continues to rise daily. Based on the latest data, there are 34 cases of monkeypox in Indonesia, with 27 cases in Jakarta, 2 in West Java, and 5 in Banten. However, Health Minister Budi Gunadi Sadikin said that the condition of a number of patients continue to improve.
In addition to isolating, monkeypox patients continue to receive treatment from health workers. Furthermore, monkeypox vaccination drives are also prepared specifically for those at risk. Acting Banten Governor Al-Muqtabar said that his staff will continue to take curative and preventive measures in the hope that there will be no more additional cases, especially in Tangerang.
Jadi ada 34 data yang terkemarin, semuanya di Jakarta kecuali 5 di Bandung. Ini lagi dibahas dan 2 di Bandung. Kabar Bang, penularannya ini lewat infeksi seksual. Jadi nggak mudah seperti COVID yang cepat menular. Enggak, ini hanya menular lewat hubungan seksual dan untuk kelompok tertentu. Sampai sekarang alhamdulillah nggak ada yang wafat karena kita bisa identifikasi cepat dan kita kasih obatnya udah ada. Kita juga sudah punya vaksinnya. Jadi vaksinnya secara di belakang layar kita lakukan karena balik lagi ini hanya diberikan ke kelompok-kelompok tertentu yang di Tangsel, dan kita tadi ya punya SOP dalam rangka itu, dan pemerintah akan menggiatkan upaya-upaya penanganannya karena ada berbagai hal di dalam tingkat kuratif itu, baik dari segi peralatan, kemudian obatannya, dan juga pembiayaan. Kita memiliki kemampuan yang cukup.
Okay, so this is interesting. Doctor, let's continue our discussion. So how is monkeypox diagnosed in human? I mean, what is the what you call it? How the symptoms, and also how you get tested and stuff like that?
Okay, so because I have already monkeypox patients also, and I work together. So if you're a doctor, a dermatovenerologist, work together with the PPI or program pengendali infeksi or infection control in your hospital. Usually the patients will come to you, to me, as a dermatovenerologist with the symptoms of fever, and they have the vesicles. If I was suspected from the anamnesis is the interview being done by the doctors, and through the physical examinations, usually there were an enlargement of lymph node, mostly all of that, from the neck area, even the axilla area and the inguinal area. And then with all the symptoms, of course, the incubation period and the lesions that look like vesicle. Vesicle is like in varicella, we call it like a dewdrops in rose petals. So it means like, it's like a water in the rose, right? Yeah. It was clear fluid like that. Yeah. But the differently, if in the monkeypox, in 5 to 7 days, it changes to black crust in the middle.
Right.
And the black crust is getting even more bigger.
Yeah.
The challenge is sometimes the patients comes to us doctors in the first and until second days or 3 days or the first, early stage of it.
You did not diagnose it as monkeypox.
Sometimes we're scared to diagnose it as monkeypox because it will cause, havoc or,
True. Like some hysterical moments.
Some hysterical moments. But however, if the doctors find out those kind of things, bring the patient, is suspected to have a monkeypox, bring the patients to the ER, take the patients to the isolation room, and make sure you work with the microbiological doctors. Usually we have doctors that specialize in microbiology, and usually takes the samples from the vesicles.
Yeah.
Taking the samples from the vesicles, also taking
that blister.
From the blisters, also from the oral cavity, and sometimes even from the anal cavity. And then we checked it through the PCR. The PCR is still free from the government until now. I mean, I have the cases and my patient doesn't pay at all for the PCR. I don't know if there is a change of, regulation or something, but then the results will come out in 24 to 72 hours, and the doctors will be informed, and
2 to 3 days you will find out.
2 to 3 days we'll find out that it is confirmed as a mpox.
What makes it worse? I mean, I read a report that in Africa, the probability of people getting or mortality rate caused by monkeypox is 1 in 10. So 1 would die from 10 cases. But what is it now? And what makes it worse? For example, is there any underlying diseases that will make it complicated with monkeypox?
Okay, thank you, Nadia. At first, like I said before, the one that happens in our country right now is the Clade 2B, that related to the less severe strain of the monkeypox. So the less severe of this monkeypox have a mortality only 1 to 3%. However, we divided the diagnosis of the monkeypox into 2. First, the monkeypox with mild symptoms, and the second is the monkeypox with severe symptoms. Severe symptoms in terms of having a complications. And what is the complication? So my patients, the one that I take care of right now, no, I don't take care, I diagnosed previously, is the one with the mild symptoms. So we just treated symptomatically, and in 3 or 4 weeks, the lesions is going to be subside, the crops is going to be scab off, released from the skin, and they were self-limiting diseases actually. But the problem is to surviving in these 3-4 weeks with those pains. We need to take care of the patients, of the management of the pain. And the second one, the severe monkeypox with complications. There are complications from brain, eyes, genitals, rectals, and ontal skin. So if brains, they might happen encephalitis or loss of consciousness. And from eyes, because it may happen in your eyes, in your conjunctiva or cornea.
No.
And if you don't treat it really well, and you don't, I need to consult to ophthalmologist, of course, doctor for treating the eyes. Because if there were lesions or vesicles in the eyes, it means it will break the cornea and causing vision loss. And the third one is the proctitis or the infections of the rectum. It means there will be a bloody diarrhea. And the fourth one is the skin complications, which is going to be a very bad scars that can be bring by deep craters that can be bring by the patients for the rest of his life. So it means it needs to be fixed by the laser or anything if they have it.
Wow. So it is very extensive.
It is. So we're going to continue discussing with you, doctor, about this monkeypox. But see the stories will continue after the break, so don't go anywhere.